All right. Welcome, everyone. Today I have with me Dr. Katie, and she is a naturopathic doctor, and her focus is on anxiety. So, we're going to chat a little bit about anxiety, stress, and a whole bunch of other stuff. So, welcome, Katie. It's so good to have you here.
Thank you so much for having me.
All right. So I wanted to ask you a few questions about anxiety that I hope you can answer for us today. I want to start with something sort of simple, but let's have you maybe talk a little bit about what exactly anxiety is. And the reason I ask this is because when I was experiencing my own symptoms of anxiety, I never actually related it to the word anxiety, but like looking back, it was totally anxiety. So I think there are a lot of other people who I've spoken to who have gone through something similar where they don't exactly identify with the word, but maybe that would help them to get some better care. So if you could maybe speak to that a little bit, that would be awesome.
Yeah, I love that that was your first question because when we get into what we mean when we talk about anxiety, that can mean different things to different people. And from a clinical perspective and from a personal perspective, it has different meanings as well. And so the first thing that I always say about anxiety is that anxiety is a feeling. And it's a feeling associated with worry, with being overwhelmed, and really it's that activation of our fight or flight response. Like, what are we going to do right now? And that is the experience of the emotion of anxiety. And in that sense, anxiety is a universal human emotion. Everyone gets to experience some form of anxiety. It's there to keep us safe. But this is not what we talk about when we're talking about anxiety from a clinical perspective. Because when you have a healthy level of anxiety, you feel the anxiety and you move through it. I like to say it doesn't stick to us. We just experience that moment of like, oh, am I safe right now? Like you're standing on the sidewalk and a car comes really close and is going quite quickly. You might step back, right, and have that moment of anxiety, but it passes because you realize you're not in danger anymore. When we talk about anxiety from a clinical perspective, and the anxiety that I focus on a lot in my practice is generalized anxiety disorder. And that sort of anxiety is a feeling of anxiety that is not related to a specific event, that's experienced all throughout the day and can impact someone's life. I was looking for a better word than life, but like it's just this list, right? It's impacting work, it's impacting home, it's impacting just someone's ability to function through their day. And because we're familiar with this feeling of anxiety, we don't necessarily know of all of the clinical ways that anxiety can show up in the body. Because I think, as you were alluding to earlier, you might have an experience of anxiety and just say, oh, I'm just really stressed out. Or might not relate to that word or that label, but that there might be tools that can be helpful in managing that, because it's anxiety.
Yeah, I love the way you put that. And I like how you explained how it doesn't stick to you. Like there's a difference between someone who experiences it constantly versus just something that you feel in the moment, depending on the situation that you're in. So yeah, that's awesome. So I want to ask you a little bit more about maybe how or what kind of tools you use and what types of things that you might have someone work through, or the types of strategies that you might give to someone who is experiencing anxiety.
Yeah, for sure. I'm happy to share that. So my practice is lifestyle focused. I know yours is as well. And so when I first talk to someone who's experiencing stress or anxiety, or we think they might be experiencing anxiety, I do what I call the 5 pillars assessment. And we go through and we get a baseline of how's your sleep? How's your nutrition? How's your exercise? Do you have any mindfulness practices or any prayer practices in your life? And then also talk about connection. This is a bit of the esoteric pillar, but we're getting into things like that, like your relationship with self, your community, and as well as your spiritual beliefs, and just understanding where all those things are at, because the next, like the really first step in creating resiliency around anxiety is building up those 5 pillars in an evidence-based manner that has been shown, so that when those things are strong, you are less likely to experience anxiety as a disorder. So that's definitely the first thing that I do, is that sort of assessment of those pillars. And then we strategically go through and increase people's, resilience in each of those pillars. And then I bring in natural therapies as well. When people see me in person, I use acupuncture. All my patients, I use a lot of teas, herbal medicine. And then I like to make sure people have a good toolbox for in the moment. So we're always, whenever we're looking at therapies or natural substances or supplements, I'm always looking at what are you doing every day that's going to keep your mood even? And then also, what are you doing during those peaks? What tools do you have so that when the anxiety kind of peaks up like this, you can bring it back down? And so much of that anxiety management is that balancing act between what do I have that I'm doing or I'm taking every day, and what can I do to bring down that in the moment? So in the moment, we usually use things like breathing exercises, mindfulness, essential oils, sometimes supplements. So there's lots of things out there. It's just about figuring out what's going to work for you.
Yeah, I love that you said that. Everyone has like their own needs, and it's very individually based, but there's always like these main topics that you want to cover and make sure that everyone has at least a baseline, like you said, the sleep and all of those other things that you do in your lifestyle. That you want to make sure that you have like at least some sort of a baseline to work off of, right?
For sure. And I find that those core 5 pillars, when they're addressed, people's anxiety can be improved so much with small things, that they're not really small at all. I've had patients just, by simply addressing like nutrition and sleep, go from, being so anxious that they're unemployed and they can't go do a job interview, to like missing an appointment with me because they were at work. And I was like, why is this? Right. And so I think we tend to discount some of the things that we can do for ourselves. And I always want to be careful in the mental health space, because I understand that there has been a history of stigma and shaming and saying, oh, if only you meditated, you wouldn't have an anxiety disorder. And that's not what we're saying, or that's not what I'm saying when I talk about lifestyle solutions for anxiety and for mental health. Instead, what we're looking at is really great evidence and a stepwise approach that empowers someone to make changes, rather than putting the blame on someone for having, anxiety or depression. Like there's a difference there, I think, in the attitude and the mindset, and in hopefully how I'm approaching things, because it can be really hard to do. When we get down to those basics, when someone is very anxious, it's really hard to get good sleep, especially if you don't have the skills to turn off that thinking mind. And so some of these basics that can be so impactful take a lot of work in order to improve.
Yeah, I totally agree with you. And I feel like we have very similar philosophies in that sense. I do a lot of similar work as you. Of course, it's for a different reason, but you have to set like this kind of baseline before we go. I guess you want to build like a foundation first before we go even higher above that. But that in itself can make so many changes and can affect so many people in such a great way. And I love that it's not necessarily really difficult to do some of these things, but it might be helpful to work with a practitioner who can guide you in that sense.
Yeah, I think especially for someone that's like struggling to make these kind of changes, having someone help you with the strategy of how to implement them can be really helpful, because it's super like I'll just talk about an example. A lot of times when someone's feeling anxious, people will say like, just breathe. And like, if you're having an anxiety attack, that is the least helpful piece of advice in that moment, because you cannot just breathe. But if you know a technique, a breathing pattern that you've practiced in moments of more calm, so the neural pathways are there and ready to step in and help you, and you use that to control your breath, you can shift your nervous system from that sympathetic state into a parasympathetic state. So you have this power with your breath to create calm, which is why people are saying you should just breathe. It's very well intentioned. It's absolutely the right medicine. It's just the wrong delivery.
I love the way that you put that. And I like how you talk about how you want to practice these things when you're feeling good, because then it builds up that, I guess, the neural pathways, like you mentioned, and you just kind of instinctively do it rather than focus on what you actually need to do. I love that.
Well, when we're stressed out, when we're in an anxiety attack, a panic attack, or sometimes they call them anxiety moments, because some people don't get full-blown anxiety attacks, but they get really stressed out. And you're not in a learning state. It's not a good time to be implementing new practices. And so really very early on in my Tranquil Minds program, we learn, and I typically teach 3 breathing exercises so everyone can kind of figure out what their favorite is. But one of the ones that I teach is the 4 square breathing. And for those of you that haven't heard that before, you inhale for a count of 4, then you hold that inhale for 4, exhale for 4, and then you hold at that bottom of the exhale while your lungs are empty before you refill them again. And why was I explaining that?
The different types of the methods for breathing that we can use, like when we're feeling good.
Right. So when you practice that and you're calm and you're in a learning state, then you build up your body's knowledge of that. And then it's easier to do when you're stressed out, because if you only practice it when you're feeling stressed, it's really hard to learn it.
Yeah, I totally agree. And I love that method. I use box breathing myself, and I actually teach that a lot. So if you guys are watching this in my Facebook group or seeing this on Instagram, there are pictures of that type of method that Katie just mentioned.
Awesome. Yeah, it's a really popular breathing exercise.
Yeah, and it's easy to remember, which I think is why people tend to use it a lot.
Yeah.
Yeah.
No, and I think people like it as well because it's a great cognitive distractor. So in addition to that benefit of the nervous system and like moving us into that calm state, it also occupies your thinking because you're like drawing the box and you're counting.
Yeah, totally agree.
That can pull you out of your thoughts.
Yes. Speaking of pulling you out of your thoughts, what are your opinions on things like doing things that distract you versus actually maybe working actively to address some of the thoughts that you're feeling that are bringing up anxiety?
Yeah. I think that there is space for both of those things in a self-care plan and in a model. And anything it's so first of all, it's just good to take stock of like, what am I doing to manage my anxiety and how do I feel about this? And this could be anything from like, oh, I take a bath to manage my anxiety and I feel like that's really productive, or to I'm drinking a bottle of wine every night to manage my anxiety and I feel like that's very unproductive. And everything in between that, maybe someone's taking a bath every night for an hour and they're like, I actually can't get anything done because I need so much chill time in my bath. That's how I'm coping. See, like any coping mechanism, when it gets used to a certain extent, can be in the way of your goals and what you're trying to achieve. And I don't know if that quite answers like the question around the distraction thing, but sometimes that can be really like a true way of self-care. If you're overwhelmed by emotion, And it's too much to process right now. Goodness knows there's a lot happening in the world right now. And I think it's okay to say right now, I've been feeling and it's a little bit much for me. And I'm going to self-care by watching a really familiar Netflix show. And I know that's going to bring down my cortisol. Maybe people don't say that, only I say that. But, like that's going to make me feel better. And then, but I think it's important when we use distraction to remember that that doesn't actually release the emotion. That doesn't process the feeling. It's still there. And so we want to make sure that we've got time to then go back and unbox it so that we don't get a jack in the box situation where we've stuffed down the feelings with distraction, and then we're at work or we're somewhere we don't want it to pop up and it comes up. So that's my
that
one
totally
thing.
answers the question. Yeah. So I love how you said that you want to do both, but maybe do what your body needs at that time.
Yeah. I'm always hesitant to say like never distract from your emotions, because I don't think that is realistic.
Mm-hmm. Yeah, I totally agree, because I feel, and maybe this is me personally, but I feel like if you push away some of those emotions, they're just going to come back up later. And sometimes it might be something that just kind of blows up in your face and you can't really handle it in that situation, and just kind of spirals you out of control, which I would like to avoid.
For sure. No, it's not just you. That's a real thing. Yeah, so I was like using that jack in the box analogy, right? Like you just kind of like, if you keep pushing it down, it's got kind of two options. One is popping up when you don't want it to, business meeting, any sort of like important life event, any kind you get overwhelmed or surprised. And then the other option is like chronic disease. Like these emotions are real physical things, and they're held. When we do that, we hold them inside of our body as molecules. And so if we're not releasing them year and year and year, like where do they go?
Mm-hmm. I love how you touched on how they manifest physically, because I talk about this all the time. Like there's such a huge component, even when it comes to things like chronic pain, there's a huge like mental health kind of component where you have to address things also mentally and emotionally, because when we hold in all those emotions, it manifests physically, and a lot of times it becomes pain.
Yeah, a lot of times it does become pain, and then you get stuck in this, or can get stuck in, a pain. Most of the research is, there's a lot more research in depression than there is anxiety, about everything. But particularly since we're talking about pain, around pain and depression. But my understanding is that that the anxiety link is just as common, just not as well researched, where you end up in this like, oh no, I'm in pain, which then makes the pain worse, which then makes oh, I feel sad because I can't do the things that I want to do. Oh no, now my pain's worse because I'm not doing these things. And there's this negative feedback loop. But anytime there's a feedback loop, there's also this like positive side of it, which is when you start doing the work on either side or on both sides, you can move it into a positive feedback loop.
Yeah, I totally agree. I love the way that you've put that. So can I ask you one thing? Maybe you've seen a lot more patients virtually, at least right now, where there's just because of all of the recent events that are going on, people are probably feeling more anxious. Has that something that you've been seeing? Is there a trend?
Yeah, it's hard for me to say people are feeling more anxious, because in my practice, we talk about anxiety all day, every day. So I would say some of my patients are feeling more anxious right now. And some of them aren't, because they've been working on their self-care and on their toolkit. And even though things got really stressful, their anxiety actually didn't pick up right now, which I was just in awe of their work. And
That's
how,
amazing.
yeah, I know. I've been so impressed with them during this. They really see, I'm like, get emotional. It's just,
You
it's my
care so
favorite.
much. That's
But
awesome.
yeah, people are anxious right now. But the thing is that people people were anxious before this.
Mm-hmm.
You know, there's things in our life that are difficult, and changes. Like, there's always life changes that come along, and I think anxiety peaks its head up when our capacity and our coping skills get overrun. And with this added pressure of, the social isolation and the pandemic and all these things, like, that has pushed up beyond a lot of people's coping skills. And so you've got a couple of options. You can lower the stress, or you can increase the capacity, and increase the coping. And I think in a lot of times we kind of have to work up both. But sometimes working on skill development is a little bit of an easier starting point than, like, your marriage isn't good or your job is actually super stressful and you need a new job.
Yeah, that can be a lot for some people.
I think it's a lot for everybody. But
Yeah.
yeah, it's not a good starting place. Don't start with the stress level. Start with the coping skills.
Yeah. So it's probably a good idea to start working on some of these things, even if you're not feeling anxious or feeling like you're really stressed, maybe to improve your resilience for something that may come along in the future.
Yeah, well, we're getting into prevention now. I like that. Yeah, I mean, a lot of people come to see me because they are so anxious they cannot stand it any more. And I would love if we could catch some of this a bit earlier. I think, when you and I were talking a little bit before this, you mentioned there's a little bit of a taboo around admitting that you even have anxiety. And I think when we can bust that out and acknowledge that this is a universal human emotion that humans sometimes get stuck in, then we can start getting some care a little bit earlier, a little bit more preventatively.
Yeah, I totally love that. All right. Well, I know that you have some resources that our viewers can access, and there's one in particular that you mentioned, that there's a stress quiz. So basically, it helps you figure out what types of stress you have. Is that correct?
Yeah, so how this quiz is called the stress response type quiz. And in working with patients with stress and anxiety, I have noticed that people's stress response takes generally one of three types. And so what this quiz does is help you figure out what type you tend towards. Of course, we all experience a variety of stress. And so this isn't about necessarily what stressors you have, but like, what's your go-to when you have it. So we talk about defensive type stress response, where you get your back up. We talk about fatigue type stress response, where you get really tired. And we talk about decision type stress response, where when you're stressed, you just like can't even make decisions. And then you'll get some resources around how to manage each of those stress response types.
Amazing. And we'll definitely link all of that below. And we'll also link to maybe some your pages where we can follow you. So if anyone...
Yeah, come hang on Instagram.
Awesome. We'll link to your Instagram page. And if anyone is interested in learning more about what Katie does or wants to work with her, you can definitely follow those links and you'll have access to all of that information as well. So I just want to thank you, Katie, for joining us today, for all of your amazing knowledge. I hope this was helpful for everyone who's watching. I just want to thank you again for being here and for your time.
Oh, thanks so much for having me. It's really nothing brings me joy as much as talking about anxiety does. So thank you for having me.
Amazing.